Welcome to the part 2 of the upper limb. This time around, we're talking about the elbow joint. This program is designed for 200 level medical students and allied medical, as well as anatomy students. Postgraduate students of medical physics, and biomedical engineering, and others who could benefit from it to serve as a revision for others. My name is Nicholas Rura, a radiologist, anatomist, and clinical scientist. We'll start by knowing the radiographic anatomy of the elbow joint, and we'll know the bones that are involved in the elbow joint. Subsequently, we will talk about the joints. And it is a little bit complex, but however, I'll make it as simple as possible. Some of the functions of these joints and the way the alignment or the bones are arranged is supposed to give kind of movements that makes the elbow joint function optimally. So we talk about the bones to start with. You have the shafts of the humerus on the distal end of the humerus. Then you have the lateral border and the medial border of the humerus. So going further down, the red we are seeing, we see the lateral epicondyle, the medial epicondyle, and the red arrow, short arrow, are the supracondyles, the lateral supracondyle and the medial supracondyle. And we have the capitulum, and we have the olecranon fossa. The bones of the elbow joint are majorly 3 long bones. That is the humerus, the distal end of the humerus, the radius, and the ulna. So we need to know the parts of these bones. At the distal end of the humerus, you have the shafts of the humerus, then you have the medial and lateral borders. When we go further, we have the lateral epicondyle and medial epicondyle. Just above the lateral and medial epicondyle, you have the supracondyles, medial supracondyle, and the lateral supracondyle. Going below it, you now have on the right, on the lateral side, you have the capitulum, whereas on the medial side, you have the trochlea. The capitulum articulates with the head of the humerus and with the head of the radius, and going further down, we have the radial neck, radial tuberosity, and radial shaft. That is on the lateral side. On the medial side, we have the ulna, the olecranon process of the ulna, and we have the olecranon fossa at the humerus. Then you have the ulna, neck, and the shaft. So with this, we can now talk about the joints. While talking about the ulna, we have the coronal process of the ulna, which now moves into the coronal fossa of the radius. So there are three main joints in the elbow. A little bit complex, but however, I'll break it down to make it easy. The first joint we'll be talking about is on the lateral side, is the humeral radial joint, which is shown by this short arrow. The lucency we have here represents the joint. And furthermore, we have the humeral ulnar joint, which is being represented with this short arrow on the medial end. And the lucency represents the joint space. Then we have the radial notch, which articulates with the ulna, and between that, there's another lucency within it, which represents the proximal radio-ulnar joint. These are basically the bones and the joints we have. But there are some things we need to know, which helps us clinically. The humeral-ulnar joint is more of a hinge joint, which allows flexion and extension of the elbow at the elbow, whereas the humeral radial joint is pivotal joint. It helps in pronation and supination, which is further reinforced with the the proximal radio-ulnar joint. The beauty of this is that after identifying all these structures in the bones, it makes it easier for us to follow with the functions of the upper limb around the elbow joint. So we'll go further to ask ourselves that the way the bones are arranged, it makes it a little bit restrict movements in basically two directions. One, because it's hinge joint, flexion, extension, and two, you have pronation and supination. I think we have, in a nutshell, we should be able to identify the bones, the humerus and the shaft, the capitulum, the head of the radius, the neck, the radial tuberosity, and the radial shaft on the lateral side. And on the medial side, be able to identify the olecranial fossa, and the trochlea in the humerus, because the trochlea and the ulnar notch, the trochlea articulates with the ulnar notch to form the humeral ulnar joint that will be able to identify the coronary process, the neck of the ulna, and the shaft. This is a very short video, and subsequent series we'll be able to talk further about the rest of the upper limb. Thank you. Please remember to like, subscribe, and share, and press on the notification button. If you have any questions or comments, please put it in the comment section. Thank you.